Sorry.
To order. We will start with the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of these items. The consent agenda consists of the discussion, consideration, and action on the following items. The minutes of the regular trustee meeting January 24th, 2023. The minutes of the regular finance meeting February 21st, 2023. And a check report January 9th, 2022 through February 8th, 2023.
I move that we approve the consent agenda as listed.
Second.
Have a motion by Dr. Simon, a second by Dr. Bowman to approve the consent agenda as it was presented. Roll call vote, please.
Gaspard,
Yes.
Burke,
Yes.
Simon,
Yes.
Brown,
Yes.
Bowman.
Yes.
Okay. Next, we have the CEO's report. Candace?
All right. In your packet, my report, have added several departments to this report now, so they're kind of getting used to reporting in the board reports. So that adds a little more information. Payroll continues to work on getting us ready for our DNB survey, which really could be about any day. Our HR records were not in the best of shape, and Maddie and I have been meeting with the Karsten team to try to get us in good shape so that we have a good survey in that department. So I think they're about to be ready for that. They are also working on getting us some help for the lab from the Philippines, I believe it is. It's a long process, but Coco's really having a tough time finding enough help for the laboratory. They're hard to come by. So she is starting that process. IT, are you going to report on those next? I'll leave the IT report to Angelica to talk about the Meditech implementation. Surgery going well. Dr. Hummel is staying busy. Dr. Gregg is doing more procedures. Dr. Daniel should be starting just about any time officially, taking appointments and getting him kicked off. Obviously, he'll be here to start out with once a month, building his practice to hopefully more and more days as he gets busier. Also not included in this report, after this report came out, we did get an appointment scheduled with Dr. Tupper, an orthopedic surgeon, who will be on site on Friday for an in-person interview for orthopedic. Central Supply, Jaden is really doing a good job in there. Jaden Lewis is helping kind of cull and organize, get par levels built for all departments that use our Central Supply materials, and trying to streamline that to cut down on waste. As you remember, we were looking at options of outsourcing, and it looked like our best option was going to be maximizing the contracts that we currently have in place, which were not being taken advantage of. Our rep indicated that we could probably save up to 25% or more just by maximizing those contracts through Vizient. So we felt like that was the best route to go, so Jaden is working on that. You can see what nursing has been busy with. Their census has kind of been up and down. I think we have 7, if I'm not mistaken, again today. So that's good. You can see our upfront cash collection amounts, which for this time of year, I was hoping that would maybe be even a little higher than that. Radiology, we've been able to save some money in that department by switching around the way we staff it. Their call and their callback, and following more along with our urgent care schedule. Making those tweaks all in all was going to save us, I think it was over $25,000 for the year. Lab, as I said, we're trying to hire. They're working on all of our, you can talk about that. Everybody's working on Meditech. It's like all the managers have 2 full-time jobs right now. Pretty busy. Maintenance, Brad has been out, and Brian has taken over, which has kind of been good because that's been the plan all along. Is Brad's getting close to retirement, and he will work for us another, I want to say another 2 years maybe at the most. But he's been out on a leave of absence, and Brian's doing a great job keeping the thing running. So kudos to him. Through that, infection control, obviously, masking is on a weekly basis, I guess. We get a notice from infection control whether our community transmission rate is high or not, and that determines whether we all have to wear masks in the lobby or just in the patient care areas. So that's interesting to keep up with. Listen, Dr. Tucker, I don't have anything else to share right now. Anybody have any questions or comments for me?
I actually do have a question. So Dr. Hummel is still coming.
Yes.
With the passing of Dr. Smith, who's now seeing those people for their follow-up, or do we know?
Mossberg does.
Mossberg.
Yeah, he and I had a conversation right about that time, and he said that he's been getting referrals from Callie, and they can follow up with her, so he wasn't too worried about it.
Very good.
I have a question. When Dr. Daniels starts coming, will Dr. Craig continue to come?
Yes,
We'll have
absolutely.
2 surgeons.
Yep. Dr. Greg, he does a lot, he does colonoscopies, and Dr. Daniel will do colonoscopies, but since we have Dr. Greg, he would prefer that Dr. Greg continue to do those colonoscopies. He's more than happy to do it if that is someone's preference, but he's happy to have Dr. Greg to be able to do that so that he can practice more general surgery.
Good.
So, yeah,
All the better.
that's right. Any other questions? Thank you.
So I would entertain a motion. If there are no more questions.
I move we approve the written report from the CEO for February 28th, 2023.
Second?
Jump right in.
All right. Have a motion by Dr. Brown, a second by Dr. Simon to accept the Share Medical Center written report for February 28th, 2023. Roll call vote, please.
Burke,
Yes.
Simon,
Yes.
Brown,
Yes.
Bowman,
Yes.
Gasser.
Yes. Thank you all. Next is the CFO's report.
All right, so we had a positive month this month. Our operating cash was ended the month about $36,000, which was about 1 day of operating expenses. Starting to improve. I know we've had, seems like every time we turn around, we've had some sort of roadblock that was kind of impeding our cash flow, and we are hopefully starting to move through those, and our cash flow is starting to improve just a little bit. We increased actually, I apologize, my notes are wrong here. We decreased our AR by about $226,000 this month. Our unbilled AR decreased to 9.0 gross days. If you remember, in the month of December, it had increased up to 16.4 because we got a coding backlog due to our coder being out of the office. So we've gotten that back down to where we kind of expected it to be. Our billed AR is staying pretty consistent around that 57-day mark. Still working towards that KPI of 55 days, but we've consistently been at the 57-day mark for about the past 6 months. Our hospital AP decreased to $828,000 as our cash flow continues to improve. We'll continue to pay that down. Candace outlined that Jaden's really working hard to negotiate our current vendor contracts and get our costs down, trying to eliminate duplicate purchasing and really streamline that whole process. So I think we'll continue to see those purchases go down and get our AP back to a level where it needs to be. Let's see here. Our gross patient revenue for the month of January increased about $180,000 over December to $1.87 million. Let's see. Our operating expenses for the month of January, we closed those at about $1.2 million, which is up just a little bit from the previous month. But we did close the month of January with $30,000 net income, net operating income for the month. So that is always great to see. Like I said, as that cash flow continues to improve, we are working with staff to look at their departmental budgets to kind of see what it takes for their departments to run, just besides the things that they have coming into their areas, making sure that they know that there's other things that it takes to run these facilities and see kind of how they're doing in their department as their own business. So trying to help them understand what those expenses are and work to get our expenses overall down. Do we have any questions on the financial statements?
Under the other operating revenue, refresh my memory what that one was.
In case I have to go look, I do not recall what that was, just off the top of my head.
I'm sorry. We probably already discussed it.
No, sales tax is down
No, that's
under
definitely-
non-operating revenue.
Oh, that's where it's at, sorry. Where are you at?
Foundation?
Oh, yes, it very well could have been money from, part of it, the money coming from the foundation that we received,
Okay.
that we used for the bids. Yes, Kelly, I'm gonna guess that probably is what that is. Thank you. Feels like that was several months ago, not just,
No, that's not all of it, though.
no, it wouldn't be all of it, some of it. Any other questions? Just to talk about Meditech, we have just about 120 days till we go live with our new EHR. It is going very well. We had our project manager from Meditech on site today just to do a status update. She met with each of our, essentially each of our leads in each of the different areas, talking to them about how they feel like the build is going, how things are looking, what concerns they have with the specialists that they're working with. I feel like that went really well. It's not been 100% smooth sailing, but we are really working through things. We have people on site every week. This week we have Lab on, well, I guess she's not on site, they're doing a virtual visit, but we are working with Lab to get that piece built. We're working on our business office build this week. Some of our clinical staff has been working on order sets and just all of our managers are doing a great job. Like Candace said, it seems like they pretty much have 2 full-time jobs. So if you see one of them, they look a little tired, it's because they are working hard, trying to get everything moving forward smoothly. Our partnership with Forvis has continued. They, just in the short time they've been helping us with the project, have proven what an asset they are to our team. They are able to sit in on almost all of the meetings and help kind of fill in the gaps for the pieces that we just don't know or that we're unsure of, or help give us some direction. It's been really great to have them helping us. So I think that'd be great. Is there anything I left out, Candace, you'd like to add? No? Do you guys have any questions on the new EHR?
I'm assuming everybody's on board. All the employees are on board with what's going on and excited.
I would say so. Right now, it's really just been like the department heads that are involved in those pieces. We will start super user training end of March into April. We'll have a mock live event in May and then start doing our end user training in June. So they'll get more. A lot of our frontline staff hasn't been extremely involved yet, but they will be as we get closer to go live. So I think it will be nice. We've had some stressors this month in e-clinicals. Dr. Burt can definitely attest to those. It's been a little rough. We had to do an update, and we've had some things there. So it will be nice to have everything in one system and not have to deal with switching back and forth between the 2 systems.
Gotcha. Any other questions? If not, thank you for that report, and we'll move to the next item, discussion action for the approval or disapproval of the purchase of 14 patient care boards from Index of Oklahoma in the amount not to exceed $38,298.39.
So,
I was going to say, we did discuss that in finance, and we believe that we should move forward with that, but go ahead.
I was just going to say, those are the patient care boards that go along with the nurse call-out system that we approved, I want to say in December, and we have COVID funds remaining that we can utilize for the purchase of these patient care boards.
They'll cover the whole.
Any questions about that?
Make a motion that we approve the purchase of 14 patient care boards as stated in the agenda.
Is it listening?
That's in the agenda.
Yeah. Have a motion?
Second.
Okay. Have a motion by Dr. Brown, a second by Dr. Simon to approve the purchase of 14 patient care boards from Index of Oklahoma in an amount not to exceed $38,298.39. Roll call vote, please.
Simon?
Yes.
Brown?
Yes.
Bowman?
Yes.
Gaspard?
Yes.
Burke?
Yes.
Okay. All right. Next item is the Medical Staff Executive Committee. Chief of Staff, Dr. Burke.
Yep, I'm going to need some help from somebody probably, but on the credentialing committee, we have 3 different appointments, or 1 appointment and 2 reappointments to discuss. And the first one is a reappointment to courtesy staff for Benjamin Love. And I think he's part of the
He's a pathologist for Heartland Pathology.
pathologist. Yeah.
I move to reappoint to courtesy staff Benjamin Love, MD.
Second.
Have a motion by Dr. Simon, a second by Greg Bowman to reappoint to courtesy staff Benjamin Love, MD. Roll call vote, please.
Brown?
Yes.
Bowman?
Yes.
Gaspard?
Yes.
Burke?
Yes.
Simon?
Yes.
And we have an appointment to courtesy staff for Brenda Gopala Krishnan. And
Tell them.
can Can you tell me about her?
She was,
Part of the,
I think she was also a pathologist.
also a pathologist? Okay.
Yeah, I make a motion that we appoint to courtesy staff Brenda Gupta-Cushman, MD.
Second.
We have a motion by Dr. Brown, a second by Greg Bowman to appoint to courtesy staff Brenda Gopala-Krishnan, MD. Roll call vote, please.
Bowman,
Yes.
Gaspard,
Yes.
Burke,
Yes.
Simon,
Yes.
Brown.
Yes.
We got a reappointment to courtesy staff for Julie Mahaney. I've slept since then,
She was
so
a telemed.
telemed.
I move to reappoint to courtesy staff Julie Mahaney, MD.
Second.
We can go ahead and do it all.
Okay.
We'll do it.
We had a motion by Dr. Simon, a second by Greg Bowman to reappoint to courtesy staff Julie Mahaney, MD. Excuse me,
Bless you.
and it wasn't making it through that. Roll call vote, please.
Gaspard,
Yes.
Burke,
Yes.
Simon,
Yes.
Brown,
Yes.
Bowman.
Yes.
Maddie, for future, if you will make sure and put on what they do for us, that will help him put it on the med, or on the med staff agenda and then bring it over to this agenda. That way he'll know for sure and we won't have to answer those questions.
Okay.
On this group. Thank you.
All right. Next item is QWAPI.
All right, get comfortable. So big report, these are all the quality improvement activities throughout the hospital that we go through, and you don't have those in your book, so I'm gonna try to get through this fairly quickly with all the departments. First one up is health information. Each of our departments have quality initiatives that they are focusing on to try to improve in at least one area. Some have more, some have less. In the HIM department, they're struggling a little bit, and Angelica and Chris are focusing on trying to get them back on track. Their department compliance is currently setting at 71.5%, which is not up to par. So they are going to be working to get their compliance up. The lab's departmental compliance are sitting at 99.7%. Not surprised, as Coco is our quality guru and director, so she has them on track. They are currently doing some COVID tracking and looking at their test kits and doing a quality study on that. The admissions department, which is up front, they're sitting at 98.4. And Coco is actually working with Lydia to help Lydia fine-tune her process of what she's documenting. Some of that might be education, their registration processes. So Lydia actually goes through each of her employees up there, and she's got certain criteria to make sure that a registration is in compliance, and keeps kind of like a little scorecard and does training if they fall behind. So that's how we try to improve our clean claim rate. We've got to have it right on the front end so that it starts that process of getting a clean claim out the door with the appropriate diagnoses, regarding medical necessity, etc. Central Supply, they're setting at 89.3%. Coco is working with Jaden to come up with a QI study that is meaningful for their department. This is kind of new for them. They're just starting that. Med staff is sitting at 93.5, and she is looking at the providers getting more involved in using SQSS. And providing education to them so that they can be caught up and compliant. Environmental services is sitting at 98.7%. Several of the housekeeping staff have been impacted due to illness, and Angelica is working with them to get them back on track. One of their, the QI study they're working on is the blower, the dryer blow down monthly is not compliant, so they're working on that. Infection control, evaluating that program, and a task has been set up to review that program annually. One of the things we're looking at is unvaccinated staff, COVID-19 vaccination tracking, employee and patient masking. Human resources is looking at job descriptions to make sure they're compliant, make sure that everybody has a signed job description, etc. Those are things that would be looked at during survey. Nursing is focusing on critical lab values regarding like panic lab values. That was something that I believe we got written on by DNB last year, and they are focusing on making sure that we are doing what we said we were going to do with panic values and notification to the provider. Medical staff, we're working on, we call them performance profiles or scorecards. There's multiple criteria of things that they have to meet on their scorecards, and we are working on getting that information flowing to the scorecards appropriately, and then that'll be something that we, that Dr. Berg will that we'll go over in medical staff once a month. Physical environment, the 96-hour plan has been approved and a task set up in SQSS to complete this annually. The hazard vulnerability assessment has been updated. Patient satisfaction surveys are being updated, and they automatically flow into the physician scorecards on SQSS. They're being emailed to the patients and are provider specific, so that information can flow directly there. And there were no trends or issues noted when those were reviewed. There were no grievances for the month of January. A grievance would be something that a patient, consumer, isn't happy about something and we can't resolve it at the time that they bring it to us. They actually leave the facility, it becomes a grievance that we have to work up. And there were none of those for January. The January Safety Committee meeting minutes were reviewed in Quappy. The nursing facilities and physical plan management, inpatient physical therapy, pharmacy, compressed gas, exterior grounds, downtown clinic, and rural clinic were all completed in January for their environmental surveillance, and there were no issues noted. No device issues. No device recalls were issued in January. We had 9 employee illnesses reported for the month of January, but no trends. There were 3 medication errors for the month of January reported. Hand washing surveillance is compliant at 100%. The CDC daily transmission rate of Woods County is monitored daily by a masking team, and the task is built in SQSS to track that. There were no COVID patients for the month of January. You tired yet?
We have an intermission.
That's it.
Okay. Fair enough. Any questions about Quappy?
Just go on, Billy. Sorry.
If not, the next item is improvement to patient care. First item is contract review, quality evaluation. This is the contract review. There was nothing that had issues. Any questions about that? The next item is the discussion and action to approve or disapprove never mind, that was the revisions report. The discussion and action, well, we need to approve that. You need to approve it.
Yeah.
There was nothing that needed action on the revisions report, but we do have to approve or disapprove that.
Make a motion to approve the revisions report dated January 30.
Second.
I have a motion by Dr. Brown, a second by Dr. Simon, to approve the revisions report dated January 30th, 2023. Roll call vote, please.
Burke,
Yes.
Simon,
Yes.
Brown,
Yes.
Bowman,
Yes.
Gasper.
Yes. The next item is the approval or disapproval of the medical marijuana used by patients policy. Got anything to add to that?
When they bring it in, we lock it up in a clear box in their room where it's within their vision so that they know that it's put in there, it's locked up, and I actually think that they keep the key, or the key is kept within, is that in there? Does it say
Right.
that?
And that,
That way, there's no pointing fingers that they had more when they came in and they're going home with less.
and
than-
no staff shall
No
assist or
staff, yeah.
participate in providing medical marijuana while on premises.
Right.
Well, I'm just curious as to why it's even allowed in the building.
Because they'll bring it with them and then you're stuck.
But then-
What do you do then?
It allows them to honor state question 788.
Oh, it's a legal issue.
Yeah.
So we're just approving to keep it in a box in the room that everybody can see that it's in there for transparency issues, I guess?
Yes.
And that we're not having anything to do with it. It's not anything that we're
Yeah.
prescribing.
Right.
And they're not using it while they're in our care.
No.
Right.
But the problem is, Bridget, they're gonna show up with it. I mean, then what do you do with it? You're stuck
And,
having to do something.
and somebody's gonna use it. And then
Yeah.
what's the next step?
And then you're prescribing drug and, yeah.
No, I'm just saying, it's gonna get put in the box with the key.
Where's the key is what I wanna know. I don't think they're using it while they're
It
here.
said medical marijuana uses during any portion of an
There you
inpatient
go.
hospitalization or outpatient visit stay will not be permitted.
There you go.
If
Well,
an
we-
employee observes a patient using marijuana products, the employee needs to remind the user of the procedure and provide an information sheet. Patient's marijuana items will be given to a family to be removed from the premises at that time.
So that's strike one. What happens to strike two? I wonder. I mean, it's just kind of vague.
If unaccompanied and not able to facilitate removal, the materials will be put in a box provided by the facility in the patient's room, placed in a secure location until dismissal or sent home with family. The patient will put the medication in the secure box, and a number tag will be placed and recorded in chart. Staff will have patient place medical marijuana in secure box and room. It will be tagged with a number as well as a sign.
A locking tag.
Yeah, as well as a signed information sheet acknowledging the procedure. This will be placed in the patient's chart.
Yes. So like our crash cart tags,
So then who has access to that? Just
they don't have access to it.
even the
It's
patient?
locked. It's locked. This is just so we can secure it and it's not laying around or in the patient's bag in the locker and then the patient says it's gone, somebody stole it. And we're wondering, then we have to test all of our staff or whatever.
Patients and visitors who fail to comply with this procedure will be reminded of the medical marijuana procedure of Share Medical Center, and if they choose not to comply, they can leave against medical advice.
Make a motion that we approve the medical marijuana use by patient policy.
Second.
I have a motion by Dr. Brown, a second by Dr. Simon, to approve the medical marijuana used by patients policy. Roll call vote, please.
Simon?
Yes.
Brown?
Yes.
Bowman?
Yes.
Gaspard?
Yes.
Burke?
Yep, yes.
The next item is the discussion action to approve the grievance policy or opportunities for improvement. Anything we want to add to that?
Do we have that? Do we have that?
Basically, when somebody ends employment, is that what we're, no? Or is this for patients?
That's for patient grievances, is it not?
Okay. Yeah, that's your real first line. So here's the philosophy behind this. Customer satisfaction is our highest priority. Customers are more likely to be loyal to Share Medical Center if we anticipate and meet their expectations at the time of service, take immediate corrective action when there are concerns, and continually improve our services from the feedback we receive. The goal is for the hospital's grievance program as it relates to the management of complaints and grievances are to provide timely response and resolution to the customer, to include written feedback to the submitting party whenever required and appropriate, avoid duplication in responses by multiple individuals, respect privacy and confidentiality, increase the customer satisfaction, provide traceable information to identify trends specific to services, processes, and departments. Ultimately, reduce the number of customers experiencing concerns and having what they perceive to be negative experiences. That is the goal.
So this is brand new, or there was some change to an existing policy?
I think there was an update to the existing policy. It was a requirement, some new requirement.
Is it the very last one that's silent?
Probably.
So there's an that has to be done.
Yeah. Adding our surveying entity.
It adds a link basically on the portal for them to be able to file that, and it also can go to the DNB.
Who is our survey agency?
Yeah.
Make a
So-
motion that we approve grievance opportunities to improve policy.
Second.
We have a motion by Dr. Brown, second by Dr. Simon to approve the grievance opportunities to improve policy. Roll call vote, please.
Brown?
Yes.
Bowman?
Yes.
Gaspard?
Yes.
Burke?
Yes.
Simon?
Yes.
Okay, that's all that. Next, Kelly, share convalescent home.
Just a quick look at the financials. We do have operating cash balance, $109,790, about 13 days of operating expenses, excluding depreciation. Our accounts receivable is at $1.642 million, and accounts payable is at $62,227. It's about 20 days of operating expenses. Gross patient revenue for January was $215,318, which was $14,000 over December. Total patient days in January were 902 compared to 924 in December. Expenses were $104,956, which was up about $9,031. And then salaries and wages roughly the same, went down by almost $1,000, $145,605. We had a net operating loss of $5,449. If you look at our 6-month trend, our operating loss is getting better. We've been focused, and Candace and Angelica both mentioned the work that Jaden Lewis is doing with materials management and central supply, and she's obviously been working with us as well. I think it's helped us to decrease some of our supply expenses. Also, we did see a bit of an increase in revenue, so that kind of contributed to the improved bottom line. Still lost money, but it wasn't as bad as it has been. So, year to date, we have revenue of $1.4 million. We have expenses of 1.9. And so we have a total year-to-date loss $321,000. As far as things, how are things going at the nursing home? We have census has remained roughly the same. We did have some admissions here in February, so we this week and then last week, and then we'll have another one next week that we're planning on. Resident satisfaction scores are still pretty good. We have our HVAC plans at the State Department of Health for their review, and hopefully we'll get their approval on those plans before long. I will be in Oklahoma City tomorrow, so I plan to go by there and just bug them to see what we can, if we can get anything done. The things we're having trouble with right now is primarily census and staffing. We don't have enough residents to, afford to be able to increase staffing. We don't have enough staffing to be able to take more residents, and so it's kind of a tough spot right now. And so we are, taking the number of residents that we can take and still provide them a quality level of care, but it's been challenged this year. Questions regarding the nursing home?
If not, Kelly, do you want to move into the homestead report?
Sure. The homestead had operating revenue of $36,655. We didn't have a significant decrease in census, and so I think probably that's a timing issue with some of the checks hitting the bank. So that'll more than likely level out when we look at February's revenue. Expenses were at a total of $51,890. We did have a net loss of $15,235. Year to date, the homestead has net income of $16,149. Revenue is down, expenses are tracking about the same, and census is the primary factor over there as well. And ever since the pandemic, it's been tough for people who want to move into residential living facilities of any kind, and so I think we're experiencing some of that. We are advertising in some regional publications, and we in January put an ad in the Healthy Living publication, which is a Enid News and Eagle publication. It'll be in a lot of places in Garfield County, doctors' offices, waiting rooms, and we've used that publication for several years, and we generally, get 1 or 2 people come check us out because of it. One of those people moving in and one pays for that, publication. Like I said, census is down slightly, 2.2%, but our total paid nights is down less than 1%. They've been continuing to work with the insurance adjusters and contractors on repairs stemming from the December 23rd fire sprinkler line break. But other than that, I will say we did hire a new activities director, Jordan Gray, and she's doing a great job. And that would conclude my report. Does anybody have any questions?
Okay, if not, Kelly, thank you. Anything from the foundation?
Foundation will meet in March. We'll be confirming new board members. You guys approved David Manning last month, and we'll have another board member that we vote on as well from the community at large. And it is scholarship time. Tell your students, if you have any students, to check out the Communities Foundation website. Our AHA scholarship is posted there, so students can go online and apply for that scholarship. And that is all for the foundation that I have right now.
Okay, thank you. Next item is the St. Anthony's report. Bridget?
Okay, and just a few items that are going on in the St. Anthony Affiliate Network. Many of y'all may or may not be aware that the Clinton Hospital had closed at the end of last year, which was very unfortunate. So they also are going to terminate the lease at Woodward. So Woodward's city is trying to get ahead of that, and so they started very early in their process of looking for a partner. So we went and visited with them and took a look, and we did write a letter of intent to answer their RFP. So we think strategically that makes a lot of sense for our affiliate network, particularly our small rural hospitals. We have a large presence out here, and as we're looking toward the future, we wonder the viability of some of the very small hospitals. So right now we're taking a look at the rural emergency hospital model, and that came out and was available through CMS at the beginning of the first of the year. It means that you don't have inpatient beds, so it's not for everybody, and it won't be for many actually until they're probably in a position where they're at jeopardy of closing their doors. But we are doing a full analysis of that. We think with Woodward, if we had to do any of those hospitals or switch them over to rural emergency hospitals, then it would be much better for the community if they had beds at Woodward that were available for them, or in Alva, or somewhere closer, that they wouldn't have to go all the way to Oklahoma City. It would be very, very convenient. So from a strategy perspective, we think it makes a lot of sense. I think it's a very well sought after engagement, so I'm not sure exactly where they'll land, but we definitely wanted to throw our name in the hat. In Purcell, I think I told y'all last time, the hospital finally got open. They opened November 2nd, and they still don't have a road done. I think I told y'all about the little road debacle, and the road is still not done for whatever reason. It's been one mess after the other. But the SSM Medical Office Building will be opening March 20th. It's one of 10 medical office buildings that we've had on our strategy list for a 3-year plan starting last year, going into the next 2 years. So we're excited that that one will be up and running because it will also offer urgent care, which the community has not had in a very, very long time. The hospital had tried to open and run it, and there's so many difficulties with that, as y'all well know. So they're pretty excited that that's going to be opening. There'll be some specialists that will actually come in person to that medical office building. We did sign up through the Saints First program, which is just our transfer agreement with our affiliate network, with Roger Mills Memorial Hospital in Cheyenne. So we've talked to Cindy Dunn for lots of years, and she was looking for just a little bit more to kind of have an opportunity to get educated and interact with a group of people as we're kind of facing hard times in the rural market. So we're excited, and they're going to join us starting March 1st. We do continue to work on our transfers, and we're having the same issues that y'all are having. Money is tight, staffing is hard to get, and so we're tightening our belts around our ship. Luckily, we're only one system in the whole city that hasn't laid off people, and I'm very blessed and thankful for that. But we continue to not perform the budget, and we kind of set our budget low this year, knowing what kind of year this was going to be. So we're upon difficult times, and we understand that. So with that, we closed our South Campus. I don't know if many of y'all are familiar with the old Hillcrest Hospital, but that's where we've had geropsych, and also are kind of hard to discharge patients that don't really have anywhere to go, but you can't really let them go out the door medically. So sometimes we have people that stay over a year with us in those beds. But because of us trying to kind of tighten our belts, we do have beds at the hospital. We just have, it's been years since we've been able to staff all of them. And we don't see that coming in the very near future. So we went ahead and moved those beds out of the main campus, and we moved like geropsych up into the St. Anthony campus, and then the hard to discharge patients over to Midwest City. So we're trying to consolidate our resources as well without not, giving up any care, but we're not duplicating services in another building. So we do have some education coming up. We're doing an Open Meeting Act. Not all of our hospitals are as fortunate to have the guidance that Alva has had over the years, and so we tend to struggle a little bit more in our other rural hospitals, making sure our agendas are correct and that we're doing everything that we're supposed to do with the Open Meeting Act. So we're having some of that education. We're going to talk about behavioral medicine, because that continues to be a growing concern. It's been a concern for a while, but it seems to be stepping up more and more and more. So just a general conversation with our group about how we handle those, how St. Anthony can help with those. Our beds are always full. They've been full since I've been working for them for 10 years. But we do stop and work with the hospitals when they are desperate for a need for something, because it's very taxing for them to stay in this environment with staff that are not trained to take care of them. So we're going to have a general conversation about that tomorrow, and we'll continue our series on quality improvement. So those are just a few things that are going to happen in our world.
Any questions for Bridget?
I had one question. I was watching C-SPAN today, and they were talking about the border, and there happened to be a hospital administrator who got on and explained what happens to their, now they're way closer to the problem than we are, but he started talking the numbers and the dollars that their hospital will never collect. Are we starting to see some of that in the area here? Because it was huge to me.
It's, we have a large homeless population, and that is what seems to be growing and growing and growing. And I think any of y'all that have been downtown Oklahoma City know that it's, it's been very visible for very many years, but I think they said that's grown by like 400%. And some people are choosing to do that, and some people are having mental issues that are causing them to land there. And so we've treated that population for years and years and years and years. And so we're very mission-based, but the amount of money that we lay out in that is amazing. It's amazing if you saw the numbers behind it. So I don't know for immigrants, I don't know. I don't know about people crossing the border. I would assume that many of them probably are migrating out into the rural areas of Oklahoma, because I think, towns that have never seen homeless people are starting
Well, I
to see
mean,
those, and
They were talking about stays that some of the folks made, and that, the homeless deal, how, as a hospital or a system, do we just eat all of that cost? And that's, here's Kelly saying that his group is losing money, and
it's a difficult conversation because, when somebody comes to your emergency room, by federal law, you have to treat them. And you have to treat them until you feel like that they can be discharged appropriately. And so, in our organization, we have tons of capabilities, and so sometimes they'll go through the whole gamut of service, and then they'll stay with us and that may not even be somebody who's homeless, that may be just somebody that they go and look at their home situation, and they're like, they can't go home, and then they have no family that will come get them. And so those are the ones that tend to stay with us.
Mental illness is a huge issue too.
Mental illness is just really something up there. And that's, and we, like I said, those beds are full all the time up at our place. It really is very, very sad to see. We were just having a conversation about this in one of the other communities. They were talking about their homeless population and how that's impacting their communities right now, just even from starting fires and just, being disruptive and causing issues in downtowns. In rural places, people are not real open to those types of things, and those tend to be happening in some of the communities. So I think there's a global issue happening out there, but that's, our hospital's given away care for a long, long time based on where we sit in Oklahoma City. That's what we had to go out and migrate so that we could at least get bigger, people that had money and payer sources in our campus, so we weren't just providing that, because it becomes very daunting.
Any other questions? No? Richard, thank you. Next is the city council report. Greg?
okay, other than what should have been some normal items, the city sold some right-of-way ground to Wheeler Brothers where the tracks ran and the right-of-way on either side to accent the properties down there. We purchased a new fire truck, which is going to greatly improve the fire department's capabilities to take care of us, and we finally have a city manager hired. No start date at this point. Everything is good. That's about it.
Okay. Thank you. Our next meeting is scheduled for March 28th. So the only other thing I got, there were no items of new business, so we are adjourned.